Executive Plastic Surgery, Bloomfield Hills, Michigan. So very interesting case. So this is a nice lady, 31 years of age, comes all the way from Hawaii. And so she has her first set of implants in 2016, what are below the muscle. Her surgeon did a wonderful job, whoever did the 16 surgery. Then she ended up getting them removed and a set of implants placed in 2018 above the muscle. So the goal was, of the surgery was to remove the entire implant capsule from her 2018 surgery, implant capsule above the muscle, and then to also remove the residual capsule below the muscle. And so that was the task. It is incomplete to remove just the implant capsule above the muscle. That residual capsule below the muscle needs to be removed as much as the capsule above. So having said this, this is a complete En Bloc 6/11/25, initials QE. Again, her first implant 2016 below the muscle, her second one 2018 above the muscle. This is where the implant capsule was removed above. And I'm overall very happy and content with how the whole dissection went. Now the one thing I want to show you here before I cut this open, this is the residual capsule from 2016 below the muscle. And this is the excess skin that I removed. And so let's go ahead and look at this. You can see, look at the inside of what is this capsule right here, clearly left behind. And this was the capsule below. Now this was a very tedious dissection without repairing the muscle, cutting the muscle. I dissected around and I removed this entire capsule or tissue, what was below the muscle. And I'm going to invert this open and you will see the internal glistening capsule. Now what's interesting is if you look at this, this is nice and round, but on the left side with the L, you'll see this is more cone shaped. And you look at this protuberance, this is suggestive of what is a rupture. But we'll eventually get to that. I have yet my sterile gloves for the right side, and I'm going to stick with my sterile gloves. I have another pair of sterile gloves underneath for the left side. So I'm going to go ahead and cut this open. It was a very meticulous dissection. I'm just getting done with my first case. And as you will see right here, relatively thin capsule. Just 1 second. I am going to go ahead and I'll put a ruler here for that. You can see how big the implant is. And you can see how thin the capsular tissue. You can see my scissors underneath. Intact implant, silicone. What I would say in brand new condition. And look at this relatively very large implant. And this is your Mentor 475cc. Mentor 475cc implant. You can see, like, look at this edge, the way the implant was kind of a little bit contracted inward, and you can see some areas relatively very thin, some areas thick. Complete total removal of the implant capsule. As you will see, some of this fatty tissue behind has been removed in order to remove all of this inflammation that is around. So very typical standard looking capsule. I'm going to remove my top sterile glove and I'm going to work on now the left side. This is for the Michigan State fans. That was University of Michigan on the right side. So this is your full thickness tissue for contouring the implants. Indeed, when they're above the muscle, the only thing that's holding the implant is the skin, and the skin is stretchy. So that's why I removed the skin. And you will see right here, this is your clearly the residual capsule. All of this inflamed tissue removed, and there's lots of it and a lot of inflammation. I'm going to cut this open right here, and you will see the inside of this area. Looks abnormal, feels abnormal, and this was not going to dissolve. The capsule does not dissolve over time, because remember, it's scar tissue technically. Now let's go ahead and look at this left side. Look at this bulge. It's like a cone head, if you will. All right, so look at this bulge, and I'm going to dissect around. It could indeed very much be intact, but it doesn't have all the features, having removed a lot of implants. Complete En Bloc. Look at some areas are so thin, but done En Bloc. No matter how thin the capsule, it has to be done in this very nice, sophisticated way. So what I'm going to do is I'm going to start dissecting here. Now this fatty tissue around has to be removed as much as the capsule, if you ask me, because this is where the inflammation is. Now what I'm going to do is I am going to I just want to highlight this area of interest. So this tissue that I'm removing is as bad as this tissue right here, because this is where the silicone has leached into. And remember, this is 2018. This is just 7 years ago. This is supposed to be the nicer, better, safer gummy bear implant. And I just want to dissect this out so you can see how this was protruding. This capsule needs to be absolutely removed. This tissue around, if I touch it, feel it, is abnormal. It has to be removed as well, because this is where, in my practice, I say this is where the burden still has spread to. So I just want to show this area that's protruding, and you can tell it does not look right. Okay, do not.
This one's.
Okay, do not.
This one's live.
Okay.
This one's trying to.
Okay, there we go. We're
Okay.
still.
All right,
yes,
now we're back.
Okay, good. So I'm going to go ahead and cut this open. Interesting, intact. So remember I said this is the contracture, so this is very much intact, and this is, to my surprise, intact. Look at the calcification starting to occur, and not a ruptured implant. Lo and behold, to my total surprise. But this is where you never know till you dissect an intact implant, literally contracted inward. And this is your mentor $475 as well. So look at this. The capsule is so thin. Look at this. You can see my glove. If I put it on top of the ruler, you can read right through it. Complete En Bloc total capsulectomy and intact implant. And no matter what, one has to always assume that the implant's ruptured to prove one otherwise. And you saw what was that clear bulge, suggestive of what is a ruptured implant, but it is not. So En Bloc, the gold standard, complete total capsule removal plus implant and all the inflamed tissue, what is above, residual capsule below. Only good, healthy, viable tissue remaining behind. The muscle was not cut at all by me. It was preserved during the dissection. This certainly added overall to the length and intensity of the case. And I'm very happy and content with how the whole section has gone. This is Dr. Khan, Executive Plastic Surgery.